Hi everyone, welcome to week 5. This week is your vital signs chapter, and that is really dealing with chapter 11. With that being said, I want to make sure that you guys bring your stethoscopes and your blood pressure cuffs this week and subsequent weeks here out, because we will be practicing quite frequently in the lab, okay? So let's jump in. Let's talk about what chapter 11 is all about. So as a medical assistant, your job really is to screen the patient. That's your job. You get them ready for the provider. And when we talk about screening for a patient, it's not just taking their vital signs and taking their measurements. It's also getting that chief complaint. It's updating their patient history, or even taking a patient history if it's their first visit into the office. And then, yes, we go into taking their height and weight. Those are measurements. And then we do their blood pressure, pulse, temperature, and respirations. And sometimes we can also do a pulse oximetry or a pain scale. Pain scale kind of makes complete sense. I don't really think I need to explain that one. Pulse oximetry, what that's doing is it's actually testing the oxygen concentration in your blood. Okay, so that's kind of the big points of a patient screening that I want to talk to you about. But when you're doing a patient screening, you also need to make sure that you are using all of your senses. And you want to watch for things in your patient like their appearance, their gait, how are they walking. You want to be able to see if there's any odors, and trust me, you will know if there is. Their lack of awareness or their level of awareness. Are they with it? Are they catching up with what you're saying? Or are they kind of lagging behind a little bit? And then also their emotional state, and this will depend on age, range, gender. All of those are going to play a different role for you guys. So please make sure that you're paying attention to those when you're rooming your patients. It's really important that when you're taking patients' vital signs, you do it every visit, but the first visit is really the most important because that's where we set a baseline for what their vital signs are going to be in future visits. So let's jump in. Let's talk about some vital signs. Let's start with height and weight. So height and weight are really important because in order to be able to prescribe patients medicine, we need to have an accurate height and weight. That's how we actually create doses for people, is based on their height and weight. So it's really important that we note those and we take those every visit. Now, if you start to notice a fluctuation or you notice a big drop or a big gain in something, you need to let the provider know because that could be an indicator of a health disorder, and we want to get a start on that right away to helping our patient. Height is normally only recorded up until a patient stops growing, but it is really important that while women are going through menopause, we actually take their height as well, because what happens is during menopause, we as women are losing estrogen, which actually decreases our bone density, causing us to shrink. If you're anything like me, you have nowhere to go. But it's always important to make sure that you are getting a height on women during menopause. Okay. Same thing with with taking weight. Because obesity is such a growing problem in the world, we need to always make sure we have an accurate weight for our patient. Otherwise, it could set us up for failure with the patient. Another reason that we take height and weight is to calculate the body mass index, or BMI, which is really the correlation between the two, the height and the weight. I don't want to talk too much about that because it is something that we'll talk about in a later class, but it's for you this week. It's important for you to understand the reason that we take height and weight is that's one of those purposes, is to take a body mass index. Okay. Let's move on to temperature. That's the next vital sign that I really want to talk about. And technically, it is the first vital sign. Height and weight are both considered measurements, so those aren't considered vital signs. So temperature is really important because we need to keep our temperature and our body temperature in a normal range to maintain homeostasis. Now, if you remember last week, I talked about how homeostasis is really just the body's normal way of life. It's how it should be. Normal body temperature is anywhere between 97 to 99 degrees Fahrenheit. So it's really important that we maintain that and we keep that within that level. Now, how we keep our body within that temperature level is based on a couple of structural things. So one of the things that help regulate our body temperature is our hypothalamus, which is found in our brain. Also, our blood vessels, they are really good indicators of how to keep our temperature regulated. along with our skin and pores, and our our neuromuscular system is also it plays a role in regulating our temperatures. Now we can take temperatures 5 different ways. We can take them orally or under the tongue. We can take them aorally, which is in the ear. If you have an adult patient, you're going to take their ear and pull it up into the back. If you have a child, you're going to take their earlobe and pull it down into the back. Please make sure that you know which way to handle the ear. There's also rectally, and that one's pretty self-explanatory. Temporally, it's going to be using your temporal lobes. So you're going to go temporal lobe to temporal lobe, so across the forehead, and then you're going to actually go behind the ear as well. And the last one is going to be auxiliary, which is under the arm. I'm making you guys do a little bit of work here. Make sure you read your chapter, because I'm going to ask you what normal body range temperatures are depending on where you take the temperature. So please make sure that you are aware of that for class on Wednesday. Next vital sign is going to be your pulse. And pulse is really when your heart contracts, or when your heart beats. So it's the contraction which transports the blood out of your ventricles and into the rest of your body. Pulse should really be taken for a minute, but you can count it for 30 seconds and times it by 2. And when you're taking their pulse, you also want to make sure you document rate, rhythm, and strength. If you have a normal strength pulse and you have a normal rhythm pulse, you can count it for that 30 seconds. If it's irregular, you want to count it the whole 60 seconds, okay? Some of the factors that may affect our pulse are, first one's a big one, gender. Women are generally going to have a higher pulse rate than men. Level of fitness is another one. Emotional state, pregnancy, fever, and medications. These all play a role in regulating and ending up, changing our pulse rate depending on our state of mind or where we're at with that. Level of fitness, if you're more of an active person, you're going to have a lower pulse rate, okay? I'm, again, putting a little work on you guys. I want you to make sure that you read your chapter and know the different places you can take a pulse, but also the different ranges depending on age for what a pulse should be. So make sure that you take a look at that and you read your chapter this week. Last one is going to be respirations, and that's really one inhalation and exhalation. That's one breath. So what I mean by that is one in and one out. That's one breath, okay? When you're taking somebody's respirations, you really shouldn't say, all right, I'm going to take your respirations now, because what generally will happen is our patient will start to do this. That's their way of saying, okay, I know they're counting my respirations. I want them to see, that I'm breathing normal. So they will end up actually breathing heavier. So don't try to do that. Just when you're doing it, I always say, take pulse and respirations together. First 30 seconds of doing a pulse is taking a pulse. Leave your hand there. The second 30 seconds is counting their respirations. They don't know that you're not taking their pulse anymore. So that's the easiest way to do it. And when we talk about what a respiration is, it's actually the exchange of oxygen and carbon dioxide within our body. Okay? Normal respirations are anywhere from 12 to 18 breaths per minute, and that's how it's recorded as a number. Okay? Some things that can affect our respiration, again, our physical activity. If I've just ran a mile, my breaths are going to be way more than if I'm just sitting here relaxed. My emotional state plays into it. My medications and my age. Children actually breathe way more than adults do, and that's how it's always been. So please make sure that you understand what the normal ranges will be depending on the age range. Like I said, children are going to be faster than adults, okay? And the last step and last vital sign is blood pressure. And blood pressure is recorded as a fraction. So your top number is your systolic, your bottom number is your diastolic, okay? Systolic number will be the first number that you hear. Diastolic will be the second number you hear when doing a blood pressure, okay? When I talk about what a blood pressure is, it's the force exerted on the arterial walls of the heart ventricles as it contracts and relaxes. So that contraction is going to be where you hear your systolic pressure. The relaxation is going to be the diastolic pressure, okay? Normal blood pressure is 120/80, and that's normal, but not everyone is normal. I know mine is not anywhere near that, but for me and my body type, it is normal, okay? there are a bunch of things that can affect blood pressure. Big one being physiological changes as we get older. The older we get, the more our blood pressure actually increases. Emotional state, medications, gender and race, diet, and other chemicals are going to play a big role in this, along with positioning of our patient and exercise. Time of day, wrong size equipment. So if you have a blood pressure cuff that is too small for the patient's arm, it's going to give them a falsely elevated level, whereas if you have too big of a cuff, it's going to make it decrease. It's going to be falsely decreased. And the last one is pain or discomfort. If I'm in pain, my blood pressure is going to go up to compensate for that pain. Okay? When I talk about positioning, you can have a patient sitting, standing, or laying down. So all three are going to be different depending on what the patient is doing. Alright, so that's kind of a brief overview of what Chapter 11 is really about. Please don't forget that your discussion post, your initial post is due on Tuesday. Your responses are due on Saturday. And your written assignment this week will also be due on Sunday. So just one written assignment. This week you will have midterms, so I don't want you guys to panic. We will do a midterm review in class, and then you'll have until Sunday evening to take that, okay? Alright guys, again, please don't forget to bring your blood pressure cuffs and stethoscopes, and I will see you all on Wednesday. Have a wonderful day, guys. Bye.